What is the science behind pre-op chemo for stomach cancer recurrence? Preoperative chemotherapy, also called neoadjuvant chemotherapy, is a treatment given before surgery to help fight stomach cancer. It works by shrinking the tumor and making it easier to remove completely. This approach aims to improve the chances of removing all cancer cells, which is very important for reducing the risk of the cancer coming back. It also targets tiny cancer cells that might have spread beyond the main tumor but are too small to see with scans. By doing this, pre-op chemo can help lower the chance of distant recurrence, meaning cancer returning in other parts of the body later on. When the tumor shrinks and the cancer is less extensive, surgery can be more successful, and patients often have better long-term survival chances. Even with pre-op chemotherapy and surgery, stomach cancer can still come back. Studies show that about 30 to 40% of patients experience recurrence within 2 to 5 years after treatment. Most of these recurrences happen in the first 2 years and often involve the liver, lungs, peritoneum, or lymph nodes. Sometimes the cancer returns locally in the stomach area, but that is less common. The stage of the tumor after chemotherapy, called the IPT stage, helps predict the risk of recurrence. If the tumor is still large or aggressive after treatment, the chances of the cancer coming back sooner and more often are higher. The science behind pre-op chemo involves using drugs like fluorouracil, cisplatin, and epirubicin. These medicines target fast-growing cancer cells to kill them and reduce the tumor size. They can also destroy microscopic cancer cells that have spread but are hidden from view. The effectiveness of chemotherapy depends on the biology of the tumor. Certain markers, like thymidylate synthase levels and immune system factors, can influence how well the cancer responds to treatment and the likelihood of recurrence. Research from major clinical trials, such as the MAGIC trial, has shown that giving chemotherapy before and after surgery improves survival rates and increases the chance of complete tumor removal. Because of this evidence, neoadjuvant chemotherapy has become a standard part of treatment for advanced stomach cancer. Even patients who have no remaining cancer after chemotherapy, called a complete response, can still experience recurrence. This highlights how complex cancer biology is and how some resistant cancer cells can survive treatment. However, pre-op chemotherapy is not without risks. It can cause side effects like low blood counts, nausea, and mouth sores, which need careful management. Not all patients respond equally. Factors like tumor type, genetic mutations, and immune environment can affect how well the treatment works. After surgery, close follow-up is essential because the risk of cancer returning remains significant despite preoperative therapy. In summary, the science behind preoperative chemotherapy for stomach cancer is based on its ability to reduce tumor size, treat hidden microscopic disease, and improve surgical outcomes. While it can lower the chance of recurrence, it does not eliminate it entirely. The tumor's response to chemotherapy and its biological characteristics are key factors in predicting recurrence risk. This personalized approach helps guide ongoing treatment and follow-up care, emphasizing the importance of working closely with healthcare professionals to develop the best plan for each individual. Always consult with your medical team to understand your specific situation and the most appropriate treatment options.